Okay, thank you everyone for joining us today. I want to introduce and say thank you to Dr. David Berger of Holistic Relief. In the last couple of years, we've had the pleasure of working with Dr. Berger. He's a board certified pediatrician with more than 25 years of clinical experience. He's also gained national reputation for his expertise in holistic pediatric primary care, with areas of specialties of nutritional and detoxification therapies for autism, ADHD, and related disorders, and also immune dysregulation such as allergies, asthma, autoimmune disease disorders, and so forth. I know Dr. David also treats adults with these medical conditions as well. So today, some of the topics that we're going to cover are going to be in related to autism are going to be sleep, behavioral control, irritability, violent behaviors, stimming, mood control, anxiety, depression, panic, improved focus and attention, inflammation control, and social interactions. I'm going to be sharing some of the links of where you can reach out to Dr. David Berger if you're interested in booking a consultation with him. And then we're going to also be sharing his social media handles. The last thing that I do want to say is that you can post questions in the chat. However, any questions directly or related to dosing, he's not able to answer for you. But if you do book a consultation with him, Dr. Berger will be happy to go over those types of questions with you. So I'm going to turn it over to Dr. Berger and let him start with his presentation.
Hi, everybody. Thank you for having me and for your time. And just to let you know, just to piggyback off of that, patients of mine in the state of Florida can see me even by telehealth through for these types of consultations. Anybody out of the state, I also have an educational consultation practice, Dr. David MD, so I can offer educational advice for all topics, not just for cannabis, if anybody ever has an interest to do any deeper diving. But thank you so much for having me. I always like to start off a little bit of kind of how I got to this place. So at 5 years old, I declared I was going to be a pediatrician to my pediatrician and my parents, and that was really kind of what set things in motion, and my path was set. When I got to finish medical school, did my residency at Tampa General, halfway through, so this would have been about 1995, there was a journal article called 7 Herbs Every Pediatrician Should Know About. Wasn't about cannabis, but it was like basic stuff like echinacea, golden seal, chamomile. And I had asked the department chair if I can start using these herbs in the clinic because it was in our pediatric journal. And they said, of course you can do that. So I started using herbs, but at the time, we didn't really know what doses was needed in order to help kids out. So I kind of took a very long path to, taking very slow approaches, which of course is kind of a thing that we all talk about as parents in pediatrics, to figure out how these different products, different supplements would work. And then kind of built my career upon this. So back in 2014 is when the Florida CBD market was opened up through dispensaries, but it was really such a limited number of people with autism couldn't use it unless they had seizures also, because autism wasn't a qualifying decision at the time. And then 2 years later, when full medical marijuana came out, but I know a lot of doctors were freaking out at this, especially with youth and children. But for me, it was kind of just another herb because I was so well versed in figuring out how to do herbal dosings with people of young children, older children, adolescents. So that's kind of how things evolved for me. Now, going back a little bit more in terms of autism, so this would have been right around that same time, there was a child with autism who was admitted at Tampa General, not because of their autism, but because she has asthma. And literally all of the residents were encouraged over the course of that day to come by the patient's room and to see this patient who has autism, because you might not see one again. And of course, we all know that it's almost like barely a day can go by in a pediatric office that I don't see a person with autism, let alone even just walking through the mall or a supermarket. We obviously, now that there's so much awareness and understanding, it's how prevalent it is. And as you may know, back then the prevalence at 8 years old was 1 in 500. Now it's 1 in 35. So, we continued to see this explosion happen. We Some of it does have to do with better identification, better diagnosis, awareness. But at the same time, that really doesn't explain to me how we could have gone in 20 years from 1 in 500 to 1 in 34. So I believe that there are genetic predispositions as well as environmental and other triggers that may set a person down a path of autism symptoms. When it comes to the work with cannabinoids in particular, due to the good work of Dr. Machulam. So this was before the pandemic, so it's kind of BC. The dates kind of get mixed up for me, like before pandemic and after pandemic. But he was able to demonstrate that the natural cannabinoids, in particular, they're looking at anandamide and 2-AG, the ones that humans make, and the anandamide was found to be lower in the blood in children with autism compared to neurotypical kids. Okay. And one of the things that we know that that cannabinoids like CBD does is it slows the breakdown of the endocannabinoids, boosting it up. And so part of the reason why I think that kids with autism and other spectrum related disorders, why many of them do respond properly, and I have not done a research on this, this is a theory only. You can't just send off a lab for endocannabinoids in America just to see where it is. So he was doing it very special at his lab. But I'm wondering if because the other thing also, even with use of medical marijuana, kids with autism, first of all, rarely act high. They don't really get stoned, even when you're giving them doses that you would typically think that would get a grown person high. And I'm wondering if that, as well as why the cannabinoids work so well with them in terms of the hemp-derived ones, is because maybe it's filling in a gap. So if one's normal and natural endocannabinoid level should be here, and so taking something that stimulates the receptor gets you to here, but if you start off down here, maybe kind of gets you more to where you were supposed to be in the first place. I don't know how I will ever be able to prove that theory, but it's kind of like a working theory. Haven't found anything that makes that not be true, but that's kind of the reason why. Now, as the years also grew, as you may know, I became a leader in autism biomedical functional medicine as well. So, part of my practice is doing cannabinoids as one of my tools, but also looking at vitamin D levels and zinc levels and intestinal microbiome, pathogens like Candida, Clostridia in the gut, looking at genetics like MTHFR and all of the other related methylation genes. And so when we talk about functional medicine, which to me, I think that's my favorite term for what we do, because at the end of it is how are you functioning? Not just outwardly, but also biochemically, etc. How are you pooping? You can learn a lot about a person's function through the way that. So that's kind of the way why I like to use that term, because at the end of the day, how functioning is this individual, and what can we do to optimize their functioning going forward? Okay, now, in terms of some of the cannabinoids, which we'll talk about a little bit more, and we will have time for question and answers. I'm planning on talking for 20, 25 minutes here or so, and then open it up for questions, so you'll have plenty of time afterwards. But in terms of the main cannabinoid, of course, the one we first learned about was CBD. I'm sure that besides those who have knowledge with THC, CBD would have been the first cannabinoid that we all learned about. For many years, that was the only cannabinoid that was available. Right. Obviously, the other ones, and one of the reasons why I became so endeared to Miriam's, a few things. I love the fact that how transparent they are with their products. Not all companies do this, where they put every single batch that they run. So first of all, they run for both accuracy. So if it says that it has 20 milligrams per dropper of CBD, it's going to be very close to that. If, obviously the fact that it shouldn't have THC in it, but all of the terpenes, but also molds and pesticides and metals and other types of things that could be problematic. You want to make sure that that's not in your product. And, these things that people selling things at gas stations and at health food stores. And it is such a buyer beware thing, because at least in Florida, hemp derived CBD in Florida and most places, farm bills, etc., is considered CBD if there's less, as long as able to be sold over the counter, as less as there's no more than 0.3% THC in it. Interestingly, though, in Florida, and I don't know what the law is in other states, but in Florida, low THC cannabis sold as CBD can have up to 0.8% THC in it. Now, again, that's not enough that would get a person high, but it is 3 times more THC than what the what the hemp-derived products are, such as what Miriam's and some of the other top companies do. And of course, if we know that THC impacts developing brains. Brains are developing until about 22 years of age. So, I mean, so while THC, I mean, I do certifications for THC. Have I seen THC work when other cannabinoids or any other treatment doesn't work? Have I seen kids been able to get off of their Risperidols or their Prozacs or their Ritalins, Abilifys, using these different cannabinoids, including THC? Absolutely. In fact, when people ask me what the most common side effect of cannabinoids are, my answer is reducing other medicines. So a good side effect. But that's really one of the things. I do also love how concentrated that their products are. Like, I mean, you can find products on the market that may be only 10 or 20 milligrams of CBD per dropper full. When you talking about 100 per dropper full, which is what Epidiolex is, the FDA approved, even the 200 milligram per dropper, that's not commonly found out there. And especially when I'm dealing with kids, where you don't want to, sometimes too much volume can be a problem for them, so the smallest amount, the smallest concentration, that can obviously make a difference as well. The fact that they taste the best that I've ever had, like, I mean, like, the CBG A is probably the least, but of the other cannabinoids that I've tasted from them, it's like nothing, in their little vanilla flavoring or the citrus flavor, the orange flavoring. I mean, it's just, I almost never have a problem getting kids to take it. And obviously we can come up with the greatest idea in the world, but if you can't get a kid to take it, then how far are we getting in terms of therapeutic approaches? And some of them do taste kind of earthy out there, and that could be an issue for people. I also love the fact that there are these terpene boosts. Nobody else that I've seen in the world is doing what these guys are doing here. The fact that, that they have these different terpene boosts out there, for energy, for focus, for pain, for inflammation, I'm missing one, calm, and that the different terpenes, so they kind of do it for you. So, when people typically are looking at medical marijuana, people will talk about indicas and sativas and hybrids, failing to recognize that really almost everything is a hybrid. Part of me, I do have like a hiccuping kind of tick that sometimes come out for me, and I try to suppress it. So if it looks like I'm taking a deep breath, like there, or kind of squinching my eyes, it's just a tick that I have. So I know many of us have ticks and our kids have ticks. So that's what's going on here. If I'm all of a sudden contorting in front of you, I apologize about that. But the fact that you can, pick the different terpenes based upon what your needs are. And I have patients who will have a daytime, energy or focus type of blend for school, and then switch over to the exact same cannabinoid, the exact same strength, but with the con boost in it at night in order to help them with sleeping. Okay, and that could be a really big difference as well. And I also just think it's cool that you can make your own terpene boost with the, pick your 4. I've had a couple of patients do it. I typically will tell patients, start with a pre-made boost, but we can always play around with it later on. And again, nobody does that. You can't get that. It's not done that way in any of the dispensaries. And so, just my hat's off to them for doing this, because it's just, it to me is what kind of makes their product line stand out there. I mean, there are lots of other good product lines out there, clean product lines, tasty, but again, this is a thing. And I think it's really wonderful that they do this. Now, let's talk a little bit now about the different cannabinoids. Okay. Sleep. If we're not sleeping, if our kids are not sleeping, how could we possibly function properly? It's impossible. Okay. Now, while I have absolutely seen CBD, and for my own person, I remember the first time I actually vaped CBD. I know you guys don't do vapes, but that's available too, from a dispensary. And I remember immediately, it was kind of like the feeling of like when you get into a hot shower and the hot water just kind of drips over your body and just melts. And like I had this sensation. And before it hit my feet, I was just like, okay, I'm calm. I can go to bed now. And so CBD can certainly help. But what I have found is that CBN. Now, CBN is probably the single supplement that gives me the most health benefit because I can sleep and sleep through the night. Now, as you probably know, most doctors in med school and residency, you get the beeper, you're being woken up at all times of day, you can't sleep, be too deep of a sleeper. And so throughout my medical school and residency, I became a lousy, very light sleeper because at a heartbeat, you may have to jump to go to a delivery, or there may be somebody in the emergency room that you have to see. So I became a light sleeper and then started waking up 3 to 4 times a night, and it was terrible. 3 years ago, there was a CBD product that was available in our dispensaries, although they only had it was only a 5 milligram, which is kind of small. And it worked for a little while, but I guess started realizing I needed more. And then that's when Miriam's came out with their CBN product. And of course, for me, I had the Calm Boost for that. But I will tell you, man, I cannot believe what a difference it makes. Rarely will I forget a dose. It happened about 10 days ago. I'm laying in bed. I actually fell asleep and I woke up about 90 minutes, 2 hours later, and like wired. And like, if I wake up maybe like once or twice a week, I'll go to pee, I'll get back to bed and back, no problem. And I'm like thinking to myself, wait a minute, you didn't take your CBN. I had my vitamins set up, and then I went to look. I'm like, you didn't. And so I realized it was in the back of the drawer, which means that we put all of our other supplements in front of it. So I didn't take it, and it took it, went fine, and been sleeping ever since. So, but CBN, if there's an issue for sleep, I will tell you, nothing at all that I've found that works like this. That's not pharmaceutical. Yeah, Xanax works. I'm a jerk the next day. My wife tells me, so I don't do that. But yeah, but it's phenomenal. Now, in terms of behavior control, okay, and I really tell all people, no matter what, because since CBN is so versatile in what it does, is I always start people on CBD first. I'll even say for nighttime, bring the CBN afterwards, or medical cannabis patients, I'll tell them, bring the CBN before you start bringing in indigos and other things to help you fall asleep, because you may not need it. And especially in a kid, when we want to use as little THC as possible, that should be, I look at THC as like the last effort. If you've tried everything else and nothing else is working, I got to get my kid to sleep. I got to keep my kid in school. I have to keep my kid from being institutionalized. I have to keep my kid from beating me up. That's one of the saddest things that we hear about with families with children with autism, as they get into their teen years and the hormones start kicking in, and then they're bigger than the parents. Their testosterone, especially that for although it can happen with girls as well, but of course the 4-to-1 ratio of males to females, and that could be really a dangerous situation. Right. So yes, there are times where I pull the THC out and it is a godsend among godsends. But a lot of times I don't need that. So, I'll always start the CBD in a first situation. Again, as I said, meant changing the different blends around, the boosts, depending on the time of day. And then I would add the CBD in. But as far as, I meant to say the CBN, excuse me. But as far as some of the other symptoms, okay, I have found that CBG, very helpful for behavioral control and moods, anxiety, depression, calming people down, often good in synergy with the CBD. So you'll see a lot of times I will do CBD and CBG in combination. In fact, I'll have even people who will do like a CBD combination for the daytime, and then at nighttime they'll switch over to a CBN CBD type of product. So it's kind of nice that we can play around with this. Most people think of hemp derived CBD, oh, there's only one product. Oh my gosh, I could spend my entire day just talking about all of the different cannabinoids and how we can utilize them, which is so cool. CBGA, that's the fourth main one that I use. And where that can be really helpful is for inflammatory control. See, the cannabinoids with the A's tend to be more anti-inflammatory, but also they, even like with THCA, you can't get high from THCA. It's not until it's heated, decarboxylated, that it gets turned into 9-delta THC, where it has that psychoactive effect. That's why when people juice from the raw herb, they, which is unfortunate that kids can't get that here, because I have parents who would be, I don't want my kid smoking it. I don't want my kid getting high, but I want to be able to juice from it and get the medicinal benefits. But I have found that CBGA is the best for pain and inflammation. My mom used it wonderfully after her knee and her abdominal surgeries, recovering from that. My dad has post shingles neuropathy, like a peripheral neuropathy. He does find that rubbing THC works there, but orally taking CBGA is what he's now finding is the best for pain and inflammation. So, many people on the autism spectrum have autoimmunity, hyperinflammation. In fact, it's believed that the inflammation that's happening to the brain, one of the things that's going on is autoimmune based. Now, and there have been a couple of auto antibodies identified for people with autism, like myelin basic protein. Myelin is the outer sheath of the nerve cells that helps the signal perpetuate immediately. There are antibodies that have been found for that. Antibodies in the pandas world, people, if you know about that, where it's the post strep autoimmune disease that causes the tics and anxieties and separation anxieties and other things, of which now we're also using the term PANS if it's not just associated with strep. That's the AS of PANS is associated with strep. PANS is more broad to other diseases as well, right? But part of all of that, and people may have heard about a test called the Cunningham panel, which shows all of these autoimmune antibodies that can be elevated. I actually don't do that test all too much because I figure these kids are all inflamed anyways, so I don't need a document, an expensive lab test to tell me that. But in the coming back to the whole concept of inflammation, that's where all of these, the CBD as well, THC as well, but that's where I also find that the CBGA really can come into play. One of the things that we also know, how many of our children with autism have intestinal inflammation? It's the rare kid when I take, because I spend a lot of time talking about poop in my practice. It's very much part of my initial intake. Not just what the symptoms are, is there any discomfort? We know that especially nonverbal kids may not be able to express their pain the way that we know that you would expect somebody to. They may do some kind of posturing or pressing over furniture, over furniture arms and stuff like that. But it's all inflammatory pain. Okay, so this is where that can be very helpful as well. And just, and that's kind of like as I started expanding out to other autoimmune conditions, at least a third, if not more, of my patients with autism, that their mom or their grandmom has autoimmunity. It's a thing, right? So then you start talking about the MSs, and you start talking about the Hashimoto's, which is the most common, or the rheumatoid arthritis, the sclerodermas, all of that. So I've kind of come to the concept of looking at, and the same thing with asthma and allergies and other things, of the concept of immune systems behaving badly. That's my diagnosis: immune system behaving badly. And what we've learned for COVID relative to the cytokine storm, that it wasn't necessarily the virus itself that was causing the problem. It was the body's immune response to that some people's cytokines just went berserko, and even that's where long COVID is now. Why is it that the same person get the same virus, and one person could be asymptomatic or just a cold, and another one could be on their death's door or worse? It's really about the body's inflammatory response. So part of, even my immune protocol, that I'll bring in things like curcumin and making sure people's vitamin D and zinc levels are good. But the cannabinoids are also really helpful for dealing with those types of inflammatory issues. Okay, so that's where that can be really helpful as well. Now, in terms of social interactions, most kids' social interactions on the spectrum probably have a basis of anxiety to it. Okay, some of them are just certainly clear, just shelled off to the world, and kind of like, unfortunately, like the lights are barely on for some of them, and that's obviously very challenging for a parent who has that level of where interactions with the child can be really difficult. But often social interactions, if it's based upon anxiety, and then we're able to use these cannabinoids and other treatments to reduce that anxiety, they can become more social. So I've seen lots of kids become more social. Let's face it, obviously, that's kind of also something that THC is known for. Probably the reason why people recreationally have used THC for, whether we believe we've been here for thousands or millions of years, certainly for a long time. Let's face it, that's kind of, probably the most well-known use for cannabinoids as well. And of course, when people, I do have patients who, because especially if they're used to the high of THC, and when I switch them, and I'll say, well, why don't you give this a try? And then, it'll work for them, but they're not realizing, because they're not feeling high, and like that feeling that some people really like. But yet, when you say, well, what does your wife say about this, or what are you observing about your kid, etc.? Especially, I do a lot of teens too. So, my practice, I'm not just autism, I'm all types of functional medicine, chronic based things. And so obviously even getting feedback from teachers, getting feedback from therapists, type of thing. I do always encourage parents, don't tell, you can let your parent, oh, we're doing some things. But I also say, don't let any therapist or teacher know exactly what you're doing when you're changing doses, increasing doses, trying new products, etc., because you want unbiased feedback. right? And let's face it, if there is a teacher who's anti-cannabinoids, they may see things negatively. Or for that matter, if somebody's really pro cannabinoids, they may see things positively. So if we don't tell them what we're doing, but we ask for a weekly report, lots of ways of doing it, where we can somewhat quantify, obviously, a kid with autism who is getting, the trials done for part of ABA, that's obviously being logged. So that's easy to see. But even if feedback, once a week, can you give me on a scale of 1 to 10, how was my kid's behavior today? How was my kid sitting in their chair today? How was my kid in terms of being disrupting today? How moody was my kid? How irritable was my kid? Okay, spend 2 minutes, teacher, please, at the end of the weekend, and send it home with my kid, or send it to me in a message or whatever, just so you can also track how things are going, because that's another one of the things. And obviously, a parent, that's the same thing I encourage people to do for at home as well, for sleep, behaviors, poops, etc. But so I think it's always great to keep that kind of thing logged, like in a spreadsheet. Okay, because let's say, for instance, that communication is the biggest concern that a parent has, which rightly so. Obviously, communication, interacting with the world, is such a huge thing, and often the holy grail for many families, right? And they may not realize all of these other benefits are happening because they're not hearing their kids speak more. Okay, in my experience, speech itself, while I have absolutely seen some kids improve, again, I think it's probably more due lowering the anxiety, making them feel comfortable, using more functional words. But if you ask me for a top 5 benefits for people with autism, speech is not one of them. Okay, I've seen it, right? But if you're thinking, oh, I'm seeing this doctor who hopefully is going to help my kids speak, and again, especially, so although in my clinic, if I'm certifying somebody for THC, that's a different appointment. I actually have 2 different businesses because all of the state regulations for that. But on hemp-derived cannabinoids, over-the-counter stuff, it's just part of my regular regimen with all of the other supplements that I'm doing, right? So if I have a family who's coming to me, not in the cannabis clinic, but even another, but a lot of people have heard about CBD. And so one of the things I'm always asking, are there any treatments that you've heard about that you had a particular interest learning more about, or that friends have had success with that you've been wanting to try? And so we will. And then sometimes when they come back, they're like, it's not doing much. But then when I start asking them the questions, well, how's the teacher saying that attention is? Well, actually, he's doing better. How's the kid sleeping? Doing better. But my kid's not sleeping. I'm like, no, I hear you. But let's try to quantify all of those things in their own columns. Maybe cannabis isn't the answer for that, but it is for everything else. And then I can talk to you about lots of other supplements that I have used, methyl B12 injections, speak fish oil, DMGs, other things that we can do for improving communication. But it may just not be the cannabis that does that. But if that's what the parents focusing on, they may not see the individual leaves for the forest that they're standing in. So we'll change that metaphor around a little bit, but you kind of get the idea of it. So yeah, so that's kind of really how I play it for the most part. So I guess that's been just about a half hour, so perfect timing. So let me just quickly go through here. So again, so focus and attention again. I do find, just as an aside, besides the focus things, even when people are doing other products or using dispensary products, limonene, which you'll find in a lot of citrusy names to things. I do find that limonene is one of the best for focus and attention. So kind of like when I'm telling people look for products for that you're trying to focus on that for focus and attention, that does seem to be a particularly good one for that. Talked about behavior control and the moods, because that's kind of, part and parcel of the same. Yeah. Okay. So I hit all of the bullets that we said we were going to talk about. Okay. So I see that there are, now there's both Q and A's, and then there's chats. Huh, I didn't know that there was both of those buttons there. Let me
So
just
it's the
see.
same questions in the chat and then the Q&A, but we're just asking people whatever questions they have, if they can put them in the Q&A, just to make it a little bit easier for you to respond.
Okay, I see where you're at. I see
Yeah.
where you're at. Okay, so let me start here. The first one, when having MH added in terpenes, MH, what are those initials? My
Same
kid
thing,
is.
Miriam's hemp.
Oh, I'm sorry. I've used the words many times. Yeah, thank you very much. Yeah, smart move on me there. Okay. Adding in, when having Miriam adding in temps to a product, my kid on TV, there is a start amount and you work up to optimal dose, or is it universal? Yeah, that's kind of what we were talking about at the beginning. I'm not going to get into specific dosings. There's very It's very patient derived. Certainly as a rule of a school of thought, that it's always a start low and go slow. But depending on the individual, the timing of the day can make a difference. Different changing of products depending on what's happening at that time of day, etc. So yeah, that's what I get into more on like a case by case basis in consultation. So yeah, it's not a universal thing. CBN for sleep. Does it help with getting to sleep and also staying asleep? There you go. Child falls asleep fine, but then wakes up 4 hours wired and does not get back to rest. So the answer it helps is with both. Okay. I time it differently. So if the issue is falling asleep, I'll suggest people do it about 45 to 60 minutes before the desired bedtime. Pardon me. If the issue is staying asleep, which is actually my issue, I can fall asleep fine. I take it right before I go to bed. Fall asleep fine, figuring that extra hour also makes it last a little longer before it wears off as well. So you kind of get there. So, but I also have people, if they do wake up in the middle of the night, but they'll take another dose of CBN at that point. And I'd rather, and maybe it takes 15 or 20 minutes to fall back asleep, but that's better than 4 hours. Or that's it for the night, because I can, I know that to some families, hey, if my kid's up at 3, no matter what time they wake up, they're up for the rest of the day. And oh my gosh, and I know how frustrating as a parent that can be. There goes our sleep, there, etc. But so it depends on that. Okay, so back to to understand fully, to get a visit before I add terpenes. No, I wouldn't necessarily that. I'm talking about more about the specific dosings. I think anybody, if you go to on the Miriam Soap website, or if you're at a dispensary, you can look to see what the terpenes are. And in the case of these boosts, since they made it easy, you could, I have no problem. In fact, I typically do add a terpene boost to whatever the product is. Okay. There's nothing wrong with just doing a CBD product, for that matter, before I met MH. That's what I did because there was no other options. Certainly in the dispensary world, where I can have people, like when we start talking about all of the different cultivars, which, people use the word strains, they're actually all the same strain because they're all cannabis sativa. So they're all cultivars of these different versions of different indicas and sativas and such like that. So what I'll educate people on there is how to find the terpene profile for that product. Okay. Now I know, at least here in Florida, all of the dispensaries have to test that and publish it. Sometimes they'll have it on their website. Sometimes they'll have it on a book that you can see when you're at the dispensary. A lot of the places do phone ordering, or you can get customer help where they can look at it there. And then you can see. So, one of the things that we share with all of our patients, which is easy, leafly.com has it. That's actually the product, the document that we use. But you'll see online where they have the different terpenes and what their effects are. Okay. And so what I can tell people, so for me, again, when I go into to get a product, I'm first saying, I need, what do you have with limonene? Let's start there. Okay. I don't care if it's, I am a cancer survivor. Thankfully it's all clear. I don't have anything coming back. They got it all out. But because of that, I also have anxiety more because of that concern. So I am a legal patient in the state of Florida. So when I go into the dispensary, I don't care whether it's 17% or 23% THC. I want to know my terpene profile. That's the most important thing for me. Right. And of course, knowing that I'm getting a clean product, which is obviously happening in both places. But again, not to belittle it, but man, am I concerned about, what's happening in health food stores. Oh, wait, I did start to say before, and I forgot. In Florida, all of the hemp-derived products at the health food stores or in gas stations have to have one of those QR codes so you can scan it. But the rule here only says it has to tell you how much THC in it. They don't have to reveal all of that other stuff that's there. My feeling is that if any company is not willing to openly share that with you or give you that instantaneously, either they're not testing enough or they know something that they don't want you to know. Right. And so, if you ask to see a certificate analysis and you see that 4 have been done in the past year, they're checking. If they give you one from this year, one from 3 years ago, one from 1977, then, they're not doing what needs to be done. So, but that's as an aside. But yeah, really any product that I use now, I never just give only the CBD or only the CBN. I say, hey, find use the boost that makes most sense to you, as a starting point. It's not wrong to use CBD, but, when we start talking about whole plant medicine, entourage effect, the synergy between all of these phytochemicals, That's all part of it. That's one of the things, and like, the Epidiolex, which is the pharmaceutical CBD product that's been approved for the couple seizure disorders, although epileptic disorders, although sometimes insurances will pay for other seizure disorders as well. It's pure CBD. There's no terpenes in it whatsoever. And it is sweetened with sucralose, which a lot of people, if you're trying to avoid artificial sweeteners, not so wonderful either, right? And so, I have people who say to me, yeah, but I get my insurance to cover it. Okay, whenever, for me, informed consent, and not just, but I mean the document that we're signing that says I'm consenting for a doctor to do something. But the basis is what's the potential benefit versus what's the potential risk, right? And I do have patients who cannot afford the higher doses that may be needed for some of these epileptic disorders. I mean, if you look at what the actual dosing for Epidiolex is for seizure, if you look at the package insert, it starts at 2.5 milligrams twice a day and can work up to 10 twice a day. Now, a 15-kilogram kid, that's 33 pounds, so a small kid, they would be starting them at 45 milligrams and working up to 150 milligrams, which blows my mind. I would never start a kid on 45 milligrams of any cannabinoid. I just think that's completely up. So, my feeling is, okay, I don't follow their recommendation, but at least they researched it. And the FDA was willing to say that these tremendously high doses of CBD are safe. So that's one thing I did get out of Epidiolex more than anything, is that finally the government is recognizing that this is a medical treatment and that super huge, almost in my opinion, superhuman doses are safe to be taking. So that's kind of an aside for that. Okay. Let's see here. Can you please talk more about management of aggressive behavior? My son has injured himself in the past and also hits us. He's 13 and becomes much more dangerous as he gets bigger. Sure. Okay. So often you can think of the majority of the cannabinoids as a chill pill or a chill drop, okay? And any of them realistically do have the potential to lower aggression, okay? Again, so, but, for me, if I'm going in that direction, I would be looking more in the CBD and CBG world. As again, now, again, one of the things just in terms of aggression, I mean, I've seen kids, become aggressive because no one realized that they had like a dental problem and they couldn't say it, or some other kind of pain problem, like an ulcer, and they didn't know and they couldn't express that. So again, trying to figure out why a person is aggressive. Well, let's face it, if we landed in the middle of somewhere where we didn't speak their language and we were having a lot of pain and or whatever, and we couldn't get across to the people there what's wrong with us, we may get pretty aggressive too, or irritable at least. So, just kind of, making sure, I know so often at doctors' offices, because it's hard to examine a kid with autism sometimes, but having somebody who knows how to examine a child with autism is so important. I mean, I consider it my dance that I do with them. I mean, it's like, I have students who rotate through my office through USF in training, and as well as with my other PA, my nurse practitioners and PA. But like I'll say to them, watch what I'm doing with my arms, with my body, my leverage, my hands, my elbows, my knees. Watch how I examine this person in order to get a good exam. I've literally rolled on the floor wrestling them, almost like they're having fun. They're not punching me or whatever, but they're just not wanting to have this done, where I have them in a bear hug and I'm able to, I'm behind them, but I know kind of where I need to put my stethoscope in order to kind of get them to do that. If I have to bring my staff in to look into somebody's ear or their throat, we'll bring in the whole team if we have to. So just as an aside, make sure that there is not a discernible reason why it's happening. Okay. But certainly, as if I was just looking for that, CBD, CBG, if needing THC, would be the thing. And, as far as that emergency brake last thing, THC works 95% of the time. I realize that that's not an MH product, but I realize that in most states it is available now. I realize in some states more than others. Like I just learned in Arizona that they don't have the clause that we have in the state of Florida, which is, there's the list of the 10 diagnoses that we voted on, and then there was an 11th clause that said similarly debilitating conditions. So what I did is I said, well, what are the debilitating conditions, symptoms associated with PTSD? Aggressiveness, irritability, poor sleep, anxiety, depression. Okay, anybody who has those symptoms, even if they weren't diagnosed with general anxiety disorder, right? But they have the symptoms because they're autistic and it's documented, that's good for me. You know, for people who have GI issues, so a lot of our kids who have GI issues. Well, Crohn's disease. So whether you have Crohn's disease or some other abdominal symptoms that are debilitating, it falls under that. We even found that there is something, because HIV and AIDS is one of them, and there is something called HIV-associated cognitive disorder. The two main symptoms are lack of attention and lack of focus. So all of a sudden I'm like, oh, I can treat ADHD people because they have those symptoms. So I realized not other day, I found out that Arizona doesn't have that, and autism's not part of that. I was actually just asked if I would help lobby for the state of Arizona for the moms there. So I'm gonna get involved with there to help get the diagnosis of autism. It was actually on there, and then they tried to take it off. So now there's this battle of do we keep it on for the final law, etc. So they figured, hey, if we have a pediatrician who works extensively with autism and these products, hey, at least we have somebody who can sit up there as a true expert. So that was kind of cool. But that's kind of the way that I would play that. Okay, next. Hi, Dr. Berger. My 22-year-old son has autism, and last 3 years, 22-year-old, I'm sorry, I may have said months, but obviously 3 years wouldn't have made sense if it was 22 months old. So let me start this again. My 22-year-old son has autism, and the last 3 months has been having seizures. High doses of CBD and CBDV hasn't made a dent. We have been advised to add small amounts of THC indica at night. Yeah, I have seen that work, not just at night. Obviously, but and again, I do believe it's the THC itself, not the terpenes that would make a difference. So of course, indica at night. Now, of course, if a person's seizures are only at night, I do have patients who have just nocturnal seizures. So of course, giving it at nighttime makes sense. If there's daytime seizures, the amount of time that cannabinoids stay in the body is not all day long for one dose. Okay, we know that actually inhaled it leaves the body quicker than if you do it swallowed. But the realisticness of that it's going to be there even 8 hours, 6 hours, more than that, probably not. Okay, so if there's daytime seizures, nighttime treatment is probably not going to get you there. Although I have had one, I did have a patient who told me that did do it at night and the seizures are fine. But I would say if the symptoms are happening during the day and you're just doing it at nighttime, you may find that daytime doses are needed in order to do that. Now, another really important thing, CBD lowers the intoxicating effect of THC. Okay, so when you hear about these one-to-one products that they sell, people don't get as high from that. I have small kids who are taking large doses of THC with their CBD and rabbit. I once had this, he was about a 70-year-old man who told me that he was taking like 50 milligrams of THC 3 times a day. Now, that should get an elephant high. And I'm like, you're really not getting high? He said, no, but I did what you told me to do. I'm taking 50 milligrams of CBD 3 times a day. And I'm like, you're really not getting high? And literally he said to me, I was a kid of the 60s. I was high the entire decade. I know what it's like. Okay. At that point in my life, it was great. Now I watch my grandkids. He's like, I can roll on the floor with my grandkids. I can get up and down. I can keep up with them. I'm able to do more with my grandkids than I could do with my own kids 30 years ago. And so, we see these things, but he says, but I'm not getting high because of the CBD. Right. So just, but yes, I have seen, I saw a grown man once, one of my first seizure patients, 10 milligrams of pure CBD twice a day. Seizures of 50 years after a head trauma went away, was able to come off of 2 of his 3 seizure medicines, still no seizures. So the power of the plant can be remarkable. And the reason why I say start off on low dosing and work up, and again, depending on the size of the person and how sensitive they may be to chemicals, etc., also dictates how many milligrams I start with and dictates how many milligrams I jump with, right? But there's no doubt that this really can make a difference for those types of conditions. So, one of the good things that I've also learned about THC, it's not going to break you. Okay. It's not going to send you off in a potential irreversible situation like some seizure medicines like Lamictal could, or like that some of the medicines used for aggressive behaviors in autism, like for Spiridol can with the tardive dyskinesia, which could be an irreversible movement disorder. That cannot happen with any form of cannabis. Realistically, even if a person consumed an entire bottle of THC, not that I recommend doing it, but the reality is, even if a kid got 10 times the dose, I've had times where mom gave a dose and dad gave a dose. They call me freaking out. I'm like, you're fine. You go to bed, you wake up the next day. It's like a reset button. Okay. So, what I tell people, if it didn't go well, whatever you did, don't do that again. Let's let's mix things up. Let's do things differently. But that's why I'm also kind of fine with pushing the levels until, oh no, my kid's high now, or oh no, my kid it's not getting any better as I'm pushing the CBD up. I definitely saw benefits as we got to 50, but as I got to 100, nothing better. No reason to stay at 100. Bring it back down to 50. So there are those kind of just things. And again, coming back to my just herbal and supplement world overall, it's just kind of the way I think, and so it's just inherent to me when I talk with patients and when I do med management, when it comes to all these cannabinoids, it's just like, I've been doing it so long that it's just, I don't have to think about it now. It's just like, oh, we can do this. We can take it this way. We can try it that way. Boom, let's go. And if that doesn't work, you let me know and we'll try something else. Okay. So that is that. Oh, seizures are always in the morning from that person who wrote that in. Yeah, so for sure, a morning would be now what I would say is, obviously if it's in the morning, i.e. before he wakes up, then obviously nighttime could be something. But obviously if it's happening in the morning, but you can get a dose in, then obviously that may be a difference. Again, in the overall cannabinoid world, and they do at the dispensaries will have, either one-to-one vapes, etc. like that. If I have a patient who is a challenge, whether it's a seizure or behavior or whatever, the moment that they wake up, okay, that's where inhalation can come in really helpful. In fact, one of the dispensaries here has THC as well as a one-to-one in an asthma puffer with the spacer, okay? Because we know that when you take it orally, it's going to take a little while to kick in, right? So, so sometimes there are those other mechanisms of taking it that if you need to kind of kickstart the day, and then you also do the oral, and then often we find that as the inhaled is kicking in, the oral has already kicked in, right? So we kind of like fill in the gaps that way. So that's another way that I also do use that. Yeah. Okay. So seizures in the morning. Okay. I think that is it.
I actually have a couple questions for you, Doctor.
Please lay it on me. You got me for 10 more minutes.
I know. So, I would say autism is probably one of our biggest communities that we work with. This is super informative. And so we get a lot of, especially through our chat, we almost daily, we get questions. And I think one of the biggest questions that I see coming through a lot, first of all, is, I guess my question to you is, when you have a patient, brand new patient that you're seeing in your office, how do you determine what cannabinoid you start with? So that's because that's one of the main questions. And obviously we can't give them that information, but I
Right.
think it'd be interesting for us to know, like, how do you figure out where to go, how to
Yeah.
start with, and if you do start with adding in a boost or not adding in a boost. So what factors help you determine where to start that person?
Right. So as I said before, I always add in a boost. Now, if a person has a problem with that product, there have been times where I'd say, let's make sure it's not the terpenes, not the reaction. Let's do a non-boost and see if that's tolerable. And if that is, I've had a few people react to olive oil. I've had a lot more people react to coconut oil, MCT, but sometimes it's the olive oil. I may say, hey, if you're reacting, just give your kid some, does your kid eat olive oil all the time? Yeah, no problem. It ain't the olive oil. Right. But like, oh no, we kind of don't use that, which of course nowadays almost everybody uses olive oil. We know universally it's the healthiest of all oils, so that's not usually much of a thing. But if you're not sure about it, or if you have a person who is chemically sensitive and you don't want to be bringing in more than one thing at a time, again, that could be somebody who say, okay, then let's use the CBD without a boost, and then we kind of see where that goes. But in general, no matter what the condition is, no matter what the symptom is, I'm always starting in CBD. Been around the longest, the most studied, the most, that's my ground. Okay. And then I will then kind of give parents like, okay, now if sleep is still an issue after you've done the multiple times a day of the CBD, including at night, then we could bring in the CBN. But no, if your kid's sleeping, but it's behaviors, bring in the CBG. Oh no, but it's because of the pain or inflammation. Oh, then bring in the CBG. So that's kind of how I CBD as my baseline, and then pick the other cannabinoids as we go, depending more towards the symptoms.
Got it. Awesome. My other question that I see a lot as well, and especially a lot of it in the groups, Facebook, there's a few autism groups. I love going through and just reading what people are saying. Is at what point do you find that, okay, this is not working for you? At what point should people try, I guess, I don't want to say give up, but I guess try something else? And especially because for a lot of people, this is an expensive alternative method that's not covered by insurance. So I know that that's a concern for a lot of people where they're trying and trying. So at what point, what time frame do you say, okay, this CBD cannabis is not for you?
Fast. Okay. And why I say that is because we know the effect of any cannabinoid is fast. Right. Obviously, recreational people wouldn't be doing it now in order to feel better 3 days from now. Right. They kind of get that instant gratification. So you should know the first day of the effect. Now, what I always tell people is when you're making a change, whether it's adding a product, subtracting a product, boosting a level, etc., give 3 to 4 days for each change. Why? Maybe he had a particularly good or bad day, right? Usually 3 to 4 days, you kind of know what you got, at most a week. Okay. But once I've kind of maxed out on something, if more than a week goes by and I'm not seeing a difference, I'm moving on. I just don't, I have never heard anybody say, oh, a year into it, finally it helped. It doesn't make sense why that would be the
Right.
case anyways,
Yeah.
because biochemically speaking, understanding how the endocannabinoids work, understanding the receptors, how that all works, it's an instantaneous system. Right. And so that's why, for these, there are other things that you do have to wait longer for. I mean, I wouldn't give somebody high dose vitamin D and see where you are 3 days later. It takes 3 months for that level to change and to equilibrate. So, but I don't think you need to be doing long periods of time at all when it comes to cannabinoids in terms of changing it. And then, if you get up to like a hefty dose and you're still not seeing something, your kid's on 50, 100 milligrams a day, a dose, I meant to say, yeah, kind of know where you're at that point.
Awesome. Thank you so much. And then my last question is when you, for example, when you get someone that's also a new patient, um, I'm guessing that you also not only talk to them about CBD and cannabis, but you also look at everything else, like their gut health. So you advise them to incorporate other alternative methods, correct?
Absolutely. Okay. And because again, I don't look at cannabinoids for most people
Mhm.
as hitting the root cause. Now, in the autism world, that may be different because of what I was saying about the lower cannabinoid levels and being boosting. So that may be the exception. Okay. But unless your body, because so if your body requires a more cannabinoids than your endocannabinoid system can provide, the question that needs to be asked is why? What's the root cause? So that's why all of those things, gut health, what we know about gut health and immune health, neurological health, that's not a holistic concept anymore. It's well understood, right?
Yeah.
Obviously, optimizing vitamin D and zinc levels, which I've been doing for many time. That's still, most doctors, and just as another side, whenever I'm doing those types of tests, I'm always looking for the middle of range. So if it says that the normal range for vitamin D is 30 to 100, I don't want 31. I want 60, 70, right in the middle, but other doctors will freak out. I'm like, why? Well, what are you complaining about? It's the middle of the reference range that the lab is telling you. Why are you freaking out on that? But that could be part of root cause. Okay, so that's where that is now. As I mentioned, I have two different, technically three businesses because of the educational consultation. Dr. David, MD. In my cannabis clinic, people are coming to me specifically for cannabis. Okay, I still bring in all of then tell them all about the hemp derived products as well. Especially in kids, parents don't say, come, wake up one morning and say, gee, I want my kid to be on THC. They say, I want my kid to be better, right? And whatever it takes. So that's why I'll explain to them. In all honesty, even though there are CBD products available at the dispensaries, they're low potency. There's not any terpenes, or there's no choices. Florida law said you only have to one CBD product. And so even when I'm having somebody who's coming to certify for the state registry, I'm still telling them about these products because I want them. This is the best I can do for them. One of the things that my mentor early taught to me was, he said, whoever the patient that you're seeing, that is the most important patient in the world. Okay. And that's where 100% of your energy, your thoughts, everything needs to be directed. You walk over to the next bed, the next room, same exact thing. So when I'm doing this, I can't in good conscience tell people, go get CBD from the dispensary. I can't. It's more expensive. Availability, especially during the pandemic, was shut down completely.
Yeah.
That was never a problem with you guys, and so, so I have to do what's best for my patient, as long as I'm not breaking the law.
Yeah.
Right. And so that's just kind of the way I approach things overall is whatever you got to do, you do.
Awesome. Thank you so much for that information. It was really helpful. The last thing I want you to kind of just maybe talk about is how important, and because we do get asked, I've been asked this question a lot, and I especially when I see it a lot in the groups is parents wondering, should I get my kid registered or get their recommendation? I always tell them yes, but maybe you can kind of talk about if it's they're only using CBD, should they get a recommendation or not? And I know obviously the laws are different in every state, but maybe you can talk a little
Right.
bit about this as
Yeah.
well.
Yeah, so obviously I'll speak in terms of Florida, okay? Considering law is different, okay? So you know, I tell patients that unless you're getting THC, there's no point in getting your card because that's access. The likelihood that you will see a doctor who knows what the heck they're doing, even if they're kind enough and went through the certification process, in Florida, for a doctor to be a certifying physician for cannabis, they have to take a 2-hour course that tells them how to put patients into the registry. There's not a single requirement to know anything about the treatments.
Mhm.
Okay. And there's very much a buyer beware type of thing there. So, the fact that I do med management, the fact that we have a full-time educator who meets with every patient afterwards and who is there to answer questions. We don't charge for questions in between. This is part of our service. So, if you don't have somebody who is versed in med management, just like you wouldn't do that with from pain medications. Oh, yeah, I wrote for Oxycontin once. Yeah, let me obviously you can look it up, but you need to have somebody who knows what you're doing. But the reality is most doctors don't. And so to get a certified card for CBD and somebody who has no clue what they would be doing with the product anyways, except for go talk to the bud tender at the desk, the 18-year-old there or 21-year-old there. No, that's not to me, that's not healthcare. So,
Right.
from my perspective, as long as a person knows the proper way of dosing, they know what to look for, and they're using clean, good products, I personally don't think it needs to be there because the card's just the formality. It's not the education.
Yeah. I fully agree. And this is why we love having these relationships with doctors like you, because we are very well aware of how important it is to have the right guidance and education. We refer people over to the list of doctors that we say you need to consult with somebody. Don't do this blindly because there is a lot of misinformation out there.
There
So
is.
thank you so much, Dr. Berger. I
Absolutely.
yeah, I shared your information on the chat. If anybody's interested in booking a consultation with Dr. Berger, he is offering 10% off your first visit with him. You can look for him at drdavidmd.com. And Dr. Berger, if you want to share any final thoughts with us or anything, please go ahead.
Yeah, I mean, the past 8 years or a little more. I mean, cannabinoids have completely revolutionized my patient care. Just hands down. It's kind of crazy. In fact, I kind of jokingly tell people that if you would have told me 10 years ago that I'd be able to do this, I would have asked you what you're smoking. Because it just kind of like blows my mind that I can do this. But then as I start realizing, for me, again, it's just so second nature to talk about this stuff. And so to me, I'm like, okay, I know what I know. And then somebody was like, oh my God, I can't believe how much you know about this stuff. And I'm like, oh, I'm like, isn't this common knowledge? No, it's not common knowledge, but also, one of the things that I also learned, there's the science of medicine and there's the art of medicine. Okay. And you can know all the science in the world, but if you can't communicate properly, if you're not available, if you're not kind, if you're not understanding, if you don't understand what another person's going through, or at least have somewhat of a chance there, all the science in the world is not going to help this person here. It's much more about the personal relationship and having somebody that you trust for the advice that you're getting. So, that's kind of, why I've always considered myself as much of an artist. I'm also a musician and have concerts. If you go to my YouTube channel, which is at which is at Dr. David MD, at Dr. David MD, you'll even see my concerts there. I have my own band called Dr. David and Friends, and one that's
Oh,
called Some
awesome.
Assembly Required. So you can see my concerts. So we'll be doing one actually in December as a fundraiser for a musical theater group where the actors are kids with autism and other special disorders, and it's called the Penguin Project. And there are different communities also in the country that do this. They'll have a same age peer mentor that is there to help the special needs individual go through their lines, their staging, their dancing, if they get distracted on stage, if they have a meltdown, and these kids are trained to do
Aw.
this. And we've seen kids with autism speak their first public words
Wow.
ever on the stage, or singing along and dancing on the stage. As a plug, if anybody has a Penguin Project community, you'll be able to check out for your kid, but just go watch a performance. Bring tissues. It will. I'm gonna start crying myself. It's the most awe-inspiring, beautiful thing that you will ever see in your life. So if you have it, just as a plug there, it's just and that's why I'm supporting them in the fundraiser. My daughter is a peer mentor. She's been doing it for 5 years. This is her life. If there's a choice of going to Penguin Project or hanging out with her friends, she's doing the Penguin Project. It's just that's how meaningful it is for us. So just as a side plug, it's something that's really cool out there.
No, that's so cool. We didn't even know
Yeah.
that you had a band. That's awesome.
Yeah. So you
Well, no,
gotta do more stuff than just doctoring.
well, no, thank you so much, Dr. Berger. This was super informative. And for anyone that wasn't able to watch this or know someone that wants to watch this, it will be loaded up onto our YouTube channel. And we'll let everybody know once that's ready to be uploaded, once it's ready and uploaded. So thank you again. And then for anybody that isn't aware, autism does qualify as a disability under our compassion program. So patients can get anywhere from 30 to 50% off all of our products. So that's another thing. Sometimes people are not aware that we do have that available. So once again, thank you so much. And
Absolutely.
appreciate everything that you do.
Absolutely. Have a great day, everybody.